First time I paid $240 on my first visit. I've had chemotherapy. I've had radiation. I've had all sorts of things, and they've not asked me for another dime. That is powerful. That's the reason why you need to look real hard at that Medigap plan. If you look, we live in Houston. We got some of the best medical facilities in the world here. We've got MD Anderson here. If you want to go to MD Anderson with an Advantage plan, good luck. You're going to have a really hard time getting in at best. If you've got a Medigap plan, you're golden. In fact, you can go anywhere you want to, as long as they'll take original Medicare. You need to go to Cleveland Clinic, go to Cleveland Clinic. You go anywhere you need to. So it's portable. So if you're in another part of the country, you want to go see a doctor in another part of the country, you don't have to worry about the networks. You can go there. Just go. I found out that the best specialist in the world for my condition is in Ohio. I go to Ohio. I go there. Whatever. It was a perfectly good insurance plan. And she showed up at her first treatment. They gave her a $5,000 injection. Guess what? It wasn't on the menu. We scrambled very quickly to move her on to another plan. It was too late to save her from that $5,000 that they gave her. But the moral of that story is that if you know that you've got procedures coming up, go to your doctor. Say, hey, doc, this is not your first time to treat this condition. What do you think that we're going to be doing over the next year? What are you likely to prescribe to me over the next year? Prescription drugs filled. I mean, beyond just the corner drugstore. That's fine. By the way, there are two different kinds of drugstores. There are preferred drugstores and there are standard drugstores. You get the better deals at the preferred drugstores. So that's going to vary by plan. And there are also programs that are government programs that sometimes help people with drugs. There are sometimes charity programs that help people with drugs. Some of those are listed on there. On the back side, you'll see GoodRx listed on there among the discount cards. There's several others that are not quite as popular as GoodRx. You should check them out and compare them. Now, there are other options. If you want to use GoodRx, you can use GoodRx, but you're going to be using GoodRx instead of your Part D plan. So anything that you buy with GoodRx is not counting toward your deductibles and toward any of those thresholds. By the way, those phases, if the $2,000 is the catastrophic threshold, the donut hole goes away. And that's going to be really good for some people. If you've got expensive drugs, if you cap out at $2,000, for many people, they're going to be maxed out in February and everything gets paid for after that. Somebody else has got to pay for it. It's probably going to fall on the taxpayers to pay for some of that stuff. It's going to compress those phases into 3 phases. So you'll have your deductible phase, you'll have your initial coverage phase, in which case many people were going to be paying 25% of the cost of their drugs. And then very quickly, you're going to move into catastrophic coverage. We talked about the initial enrollment period. We're going to talk about 2 other enrollment periods, and we will call it good. The annual election period, and that's between October the 15th and December the 7th. If you can't remember those dates, it's okay. You'll know because that's when all the commercials come back on your television. That is the time when you're going to change. If you're on an Advantage plan, it's the time you're going to change your Advantage plan. So if I'm working with you, I'm going to call you up. I'm going to say, hey, how's your plan working out? Let's take a look at next year's plans. Let's make sure that that's still a good fit for you. We're going to do that between October the 15th and December the 7th. Same thing with your prescription drug plan. If you need to change a prescription drug plan, then you can do that. You're going to make that change between October the 15th and December the 7th. Whatever you do between those 2 dates takes effect on January the 1st of the next year. This is very, very important for people who are on these Part D plans this year because the plans are changing because of the Inflation Reduction Act. Stuff is going to move around. And you're going to get, if you're on one of those plans already, you're going to get an annual notice of change in September because they're all required to send them out. But like everybody who's not an engineer here will throw that mail away. Only the engineers read it. The rest of you will say, oh, it's junk mail from my insurance company. It's legal stuff. Throw it away. And you don't read it. And then you don't realize until you show up at the pharmacy on January the 1st. Is like, oh, wait a minute, something's different here. And at that point, it's too late to fix it. So we want to look at that. Tell all your friends who are on Medicare, let's look at your prescription drug plan during this annual election period. Very important. There's one other election period in here called a special election period. There's various flavors of special election periods, special enrollment periods. So when you retire, you get a special enrollment period. You're going to have a couple of months to get onto a prescription drug plan, or to get onto an Advantage plan, or to get onto your A and B. It's a special enrollment period because you're retiring. You're leaving your group health insurance. Another one that I think is really important to take note of is, remember these plans have networks. You're on an HMO plan. Think about it. You got a local network of doctors. They're looking at your zip code. And so if you moved outside of the county, or you move a couple of counties away, your doctors aren't going to be there anymore. And so when you move, you change your residence, you're going to tell Social Security, oh, I moved. And they're going to say, whoa, you're not where you're supposed to be anymore. You need a different plan. And they're going to give you a special enrollment period of 2 calendar months to make a change. So we're in August right now. If you were to move, let's say I moved to Florida to be with my grandkids in Florida. Then I've got all of August, September. I'm terrible with the months. No problem. I contact my trusted independent Medicare broker and say, I need to get on another plan. They find another plan in my area. This medical underwriting business. It's one exception to getting you from an Advantage plan over to a Medigap supplement, because it's going to be guaranteed issue during that 2-month window. No questions asked. Remember that. File that in the back of your mind, because that could be a lifesaver someday. So there's some really good PPOs out there that have national networks. They're just going to say, oh, you can get another doctor in our network over in Florida. But if you're on an HMO plan and they're all right here in Houston, and you move to, let's say you move to Austin. Yeah, you moved to Austin. Well, that's going to take you outside of the area. You're going to need to get a different plan. For some people, it would be. That's correct. For some people, it would be. It would make sense. And there's also a special enrollment period for natural disasters. So if we have a hurricane that blows through here and blows down 100 trees in your yard, then you're going to get a special enrollment period, because the government says, oh, you might have been preoccupied with getting the trees out of your yard during that time and not able to enroll in your plan. So if that disrupts your ability to engage in normal activities of the annual election period, then they'll get you a special enrollment period there. There's all sorts of things that you could get a special enrollment period for. Talk to your trusted independent Medicare broker. We deal with this stuff all the time. We will find something for you. You need to go, you go. If you haven't paid your $240 deductible, I asked that question. I asked that question just for you. And the answer that I got was that there is what I had said before, and I'll say it for the rest of the class, is that with a Medigap plan, you have Plan G, you have limited emergency coverage outside of the United States. Yeah. By the way, some of these Advantage plans actually have some emergency coverage outside of the United States. But the Medigap plans have coverage up to $50,000 during a lifetime. They have a $250 deductible, and they will, that is applicable during the first 60 days that you're outside of the United States. If you're on a cruise ship, they get funny rules. Get the travel policy. They're relatively inexpensive. They're very much worthwhile if you're on a cruise ship. The chances of you getting sick on a cruise ship are pretty high.
You had talked about premiums. For here is zero on Advantage.
Mhm.
The Medigap obviously is not going to be zero.
No, it's not. And let's just do some quick math on it. So let's just say this is $175 a month. And let's just say this is $150 a month. And let's just say this is $50 a month. And we hadn't even talked about the dental plan yet. I should talk about that. That's $375 a month. Do some quick math on that. That's about $5,000 a year. For a female, it's going to be a little bit less. And of course, I'm just giving you real quick numbers right here. It depends on the plan you get, and it just depends on your circumstances as to what that will be. But those are it's a pretty good benchmark to work off of. Dental, vision, and hearing. We talked about vision and hearing, and we talked about dental. There is one dental plan that I kind of like. Some people really want a dental plan. Like, I've got bad teeth. I talk to people that have tens of thousands of dollars worth of dental work coming up. They know it's coming up. They want a dental plan, and we need to find them a good dental plan. Or they've been on a company dental plan forever and ever. That's how they work. That's how their mind works. That's what they're comfortable with. And they want a dental plan. One way or another, they want a dental plan. And most dental plans are not that great. They're going to say, we're going to cover you for 50%. I'm just making up something here. 50% up to $1,500 or up to $2,500. There's a plan I really, really like that covers 100% of routine doctor visit or dental visits from day one. Get your dental insurance. You go to the dentist the next day, get your teeth cleaned, get your x-rays, get your cavity filled, simple stuff, covered 100%. All dental plans have a waiting period. Most all dental plans have a waiting period. And it's usually 12 months because they want you to get seasoned into it. Otherwise, people would get a dental plan and they would go get their root canal and then they would drop their dental plan and the dental plans would go broke. So they want you to keep their dental plan for a while and pay your premiums, and then they start paying for major stuff. It's usually 12 months. Dental plan after 12 months will cover 70% of major dental procedures. They cover 400 different major dental procedures. They cover 70% of them with zero deductible, and there's no maximum. You could literally have $20,000 worth of dental work done, and they will cover it. So are you working for a company that has 20 or more employees? Okay, then you don't have to get onto Medicare at all.
Oh, I don't.
No, save that $174.70 a month. Just wait.
But you pay the penalty for life.
No, if she has coverage right now she's got group health coverage. She works for a company that has 20 or more employees.
Okay.
You have options. If you want to get onto Medicare, if you're like, hey, you know what? $375 a month, I get really good Plan G coverage. I don't have to pay any copays, deductibles, deal with networks, any of that. You might want to do that, but you have options. You have choices.
Part A.
Well, there's no reason for you to not enroll in Part A, except for the health savings account thing, and that doesn't apply for you.
No.
So just go ahead and enroll in Part A, and
That's it.
yeah, don't check off I want Part B. Yep, the L564. You got it. Then you call me. Call me then.
Yeah.
Okay. That's the one thing I ask of you. I do these things for free. Whenever the time comes, call me, because that enables me to do this for people. I know it's not that great though. Just go in and say I'm paying cash. You don't have to have any special discount cards or anything. You just say I'm paying cash. They give you the discounts. Get your Dave Ramsey emergency fund to pay cash for these things. Part A and B. Yeah, you need to go ahead and get on that. Go to ssa.gov. Yeah, and so yeah, set up a profile if you haven't done that already on there. And when you get into your profile, you're going to see a couple of buttons in there. You're going to see one that says Start My Retirement Now. Don't click on that unless you're ready to start taking Social Security. Scroll down further, and you're going to see one that says Enroll in Medicare. And that's where you're going to do that. Go ahead and enroll in Part A and Part B. It's going to take Social Security about 3 weeks to get you a red, white, and blue card. When you get the red, white, and blue card, then that's your reminder. Call me, and we'll take it from there. We're going to go with one of these. Yep. You're not going to have to worry about being late, other than you're not going to have insurance. So you're fine. You're going to be fine. Yeah. So if it's, let's say you're probably going to get a start date of September the 1st. But if it is beyond September the 1st, it's fine. We're going to start everything October 1st.